ADHD is one of the most common problems with children who are going to school. They have difficulty focusing, they can't complete their task on time, they often need more time, they are disorganized, they are usually a poor listener, and it causes many kind of difficulties in their behaviors. Often lead to academic failure, difficult in social skill, and difficulty in home setting as well. We provide a thorough diagnostic evaluation, which include a psychiatric evaluation with careful history, family history, and our therapist, Dr. Chesnov and Dr. Davidson, along with Dr. Sullivan, provide detailed neuropsychological testing to determine and confirm the diagnosis, which often leads to clear identification of areas of difficulty, and based on that we recommend school intervention or different kind of resource intervention in academic setting, along with as needed for medical treatment, which includes psychopharmacological treatment for ADHD. If you approach this treatment with good psychopharmacological intervention along with behavioral therapy, you often achieve the best result with ADHD. The other aspect of ADHD which I really wanted to emphasize is about adults. Adults often have this problem for many years. They know that they don't really do anything about it. It leads to various problems. One of the problems is difficulty in their work setting, procrastination, disorganization at home, difficulty in maintaining relationships. Often they're involved in frequent automobile accidents as well. And if you take the most recent data, it shows that this diagnosis of adult ADHD is increasing. People are more likely to get treated, they are identifying this problem, and they are doing something about it. Recently, in last 10 years, this is increasingly identified as a major issue in adults, which they often know that they have this problem, but yet they really don't want to do anything. There's stigma about it, taking medication. They're also worried about what implications it may have on their health. Often the families don't believe in medication, they don't do anything about this, but once you get into early adulthood, you realize that this is a really a big problem. Sometimes ADHD is coexisting with mood disorder, often with anxiety disorder, and these two conditions lead to a difficulty in treatment, particularly with stimulants, because the stimulant can make those conditions worse, and they need to be treated before you can try them on the stimulants. We provide that kind of thorough evaluation to determine specifically how and what order we use the medications, and this also includes proper education about the problem, behavioral modification, and supportive therapy.